Right. Today, in this video, we are going to discuss about the importance of quality starts in healthcare in context to the improvement of quality in any services while we are providing to the patients and all. It's always important for us to understand the importance of quality because care management and case management is one of the key and important element we use it in the field of healthcare services while we are providing to the patient. At the same time, it's also important for us to understand about the kind of importance of quality starts, especially when we are using the services like CMS, which is like Center for Medicare and Medicaid services, all that. On this regard, we need to understand about the importance of quality rating systems, which we call it as a used as a strategic tool uh, used by the CMS services like centers and all, Medicare and Medicaid services and all. This is majorly used to measure the rate of plans quality and as well as performances. Because when it comes to the services and as well as quality rates and all, everything may have some uncertainty due to the market conditions and all that. So it's always important for CMS to measure the rate of a plan quality and as well as performances, especially in the market. And that too, this quality rating system as well as the services we do majorly by focusing on the Medicare plans. It's not something for Medicaid kind of, because Medicare is a standard plan, as we all know. Across nation, this is being used and this is being served for all the people. But whereas when it comes to the Medicaid, is a kind of plan exclusively meant for low-income group people. At the same time, this is being managed by the state governments. Respective state governments will be managed. But when it comes to the Medicare, it's not the case. Medicare is a standard plan, which is applicable as far as services is concerned, applicable for all the people, right, across nation. So the kind of quality rating system, whatever the tools are we implementing to rate and measure the performance of the plans and all, everything is completely focused towards the Medicare plans, all that. At the same time, when it comes to the rating system, right, majorly this rating system majorly helpful to inform whatever the Medicare enrollments and all, everything when we are comparing with health plans, all that. So that is where generally this rating system is something helpful, because whatever the Medicare enrollees we are doing, right? So when we are comparing with any other health plans and all, everything, this is got something which normally it does that. At the same time, whatever the kind of plans being rated under the 4 stars or above receives the kind of quality bonus from Center for Medicare and Medicaid services, because providers will come up with some different Medicare advantages plans. Depends on the kind of quality services which they are providing. Whatever the stars are we going to provide, right? So normally it is more than 4 stars or above. That automatically CMS will provide some quality bonus and all, everything. So this results in enhances the plan's ability to add more benefits, services, resources, which will support the members' health and as well as well-being in long run. Because why are we discussing about this as an important element nowadays? Because when we are following the traditional models for a very long time, which will be used to improve the clinicians and as well as care quality providers, by considering the present healthcare services as well as expectation in context to the market itself is concerned, this is not something, traditional models are not something supportive. Hence, we require some holistic approach which should impact the member engagement, compliance, and satisfactions, result in improving star ratings in the process. So, when it comes to the star rating, as I stated, is like Medicare Advantage, members require more focus on case management and care coordination, all that. And whatever the health plans, we want to see a steady improvement in star ratings that needs to combine a high-touch model with strategic developed initiative plans. Majorly to transition from one-and-one mentality to an ongoing approach to care will bring multi-phased and cost-effective care to patients who requires it. But from the payer perspective, when we are trying to improve the quality in context to the services we are providing and comes under the Medicare Advantage plan or something, there are some points we have to be focused more on. One is about the data sharing part. The second, year-round electronic chart collection. At the same time, the kind of quality incentives we are providing, followed by field-based practice resources. So these are the areas where we have to be focused more to improve the quality and stars in the healthcare. Along with this, finally, Medicare star ratings are the one which majorly used as an effective way to differentiate the plans in the market, because if anybody wants to verify whether the organization providing high quality care, so based on the star rating which was provided for a particular healthcare advantage plan, Medicare Advantage plan and all. So end of the day, the people who has taken these plans will be benefited by getting some quality care and case management from the healthcare organizations, which will be authorized by CMS, because based on the star rating, whatever the quality bonus and all, everything will be provided by the CMS subsequently. So this is what something which all about the quality stars in the field of healthcare, especially it is being used. At the same time, this is something nowadays are becoming more important when we are going for migration side, because whenever we are working on the migration side from old legacy systems to the new application, or from one healthcare administrative solutions to another one, right? So when we are moving from a regular model to QNext, or QNext to some other thing, face it, so whatever that is, whatever the healthcare solutions we are doing, when there is a data migration usually taken place. So understanding and importance of this quality rating system is also one of that, because earlier legacy systems quality system might be different, but when it comes to the migration, when we are working on new healthcare administrative solutions and all, the plans and all, whatever the quality rating system will be something different. Okay, so understanding about this will also be useful for any persons who are working on the data migration projects, or who are applying, or who wants to have some knowledge over uh, this quality starts and all, everything will be useful to them when they are working on it. This is all about this video. Thank you.